The objective of this study was to determine how visit patterns to family physicians were impacted by the pandemic and the role virtual visits played in delivering care. As we're all aware, on March 15th, 2020, province wide restrictions were implemented to address the COVID-19 pandemic. In response to these restrictions, specific billing codes were introduced to provide another option for patients to connect with their family physician safely via a virtual visit. This study was designed to explore the visit patterns in primary care during the pandemic by comparing to historical norms. We stratified visits by type, so virtual or in person, and by zone, as well as by examining the age and sex of patients who had a visit. The following graphs demonstrated COVID-19 pandemic had an initial impact on the weekly visit volumes from April to June of 2020 to family physicians practicing in Alberta. This decrease in visit volumes occurred despite the implementation of virtual visit codes, which accounted for nearly 40% of visits to primary care early on in the pandemic, but stabilized to 20% going forward. However, the weekly visit volumes recovered to near 2019 volumes by July of 2020. Visit volumes were similar across most of the zones, with the exception of Calgary, who had a greater uptake of virtual visits, as well as between males and females. Although patients over the age of 80 did not exhibit any noticeable change in visit volumes, our study suggests patients under the age of 18 years avoided primary care. So please do not hesitate to contact us if you have any questions or comments.